Okay, hello again. This is Dr. Chris Hughes with The Tooth and the Matter, and I'm at Hughes Dental Arts Center in Herrin, Illinois. Today's topic is probably one of my most favorite, if not probably my favorite topic, which is about dental implants. As the general public knows, dental implants have come into very common usage in dentistry in the past 10 to 15 years. Actually, implant dentistry has been around a lot longer than that. It's probably been around more closer to 40 or 50 years, but hasn't really come into what I would call a common and accepted treatment modality for replacing teeth or securing dentures until about the last 20 years. So anyway, I think the first thing that we ought to talk about is, what is a dental implant and why is it such a superior way of replacing teeth? So first of all, what we need to know, I've got some models here today to show you, but so we're going to start basically just looking at some anatomy here of the skull, okay? And basically, here are the teeth, and the teeth are anchored into the bone, okay? Some people are not even aware of that, but actually the teeth are anchored into the bone. That's why they don't move, and that's an important concept, is teeth shouldn't move. So anyway, now that we know that the teeth are anchored into the bone and the gum surrounds it, let's kind of go into Implant 101 and how does it work, okay? How does a dental implant work? I get all sorts of questions about that, a lot of confusion about what a dental implant really is. People will come in with a full set of teeth that don't need any teeth replaced. They'll say, I think I need dental implants. And I'm like, well, actually, your natural teeth are doing pretty good. They could be made to look better, and some cosmetic dentistry could be done. But actually, if your teeth themselves are healthy and in good shape, generally you don't need to replace them with a dental implant. So anyway, getting into the basics of what a dental implant is and how it works, this is a cutaway view of the jawbone that I just showed you. And you can see that this part here is actually the bone, and this part here is the gum tissue that covers the bone. And of course, in a natural tooth, the natural tooth root is rooted into the bone. That's why the tooth doesn't move, because it's actually attached to bone. And then the part that we chew on is, of course, above the bone and above the gum tissue, and it's right here. So anyway, a dental implant is very much like a natural tooth in that it is attached and rooted into the bone. As a matter of fact, the best way to think about a dental implant is that it's actually the replacement for the root of a tooth. So let's look at this a little bit further. We're going to take this part off, and we're going to take this off. And we're going to talk about the dental implant and how it works. So this is what you see right here, this metal cylinder that looks basically like a screw. This is actually the dental implant. And as you can see, it is in the bone, just like the root of a tooth. And that's, again, why it's called the replacement. Sometimes it's called a replacement for the root of the tooth. So the implant goes into the bone, and people may be wondering, how do you put it in the bone? Well, we actually reflect the gum tissue back, or sometimes we make a little tissue punch of the gum tissue and remove that, and then we go into the bone and make a little opening into the bone, and then we widen that opening, and then we actually put the implant in. The implant actually screws in, most implants at least screw in, I would say about 90% nowadays screw in, similar to like screwing in a wood screw into a block of wood. So another analogy is like if you were putting a wood screw in, sometimes you would want to drill like a little pilot hole to give the wood screw an orientation and sort of a path to follow. That's how a dental implant is actually done. An opening or length of the implant is drilled into the bone, and space is created, and then the implant is screwed in. So this is actually the dental implant. Now, some people think that the implant is the part that goes above the gum line, which is not true. This is the implant itself. And when dentists talk about implants, that's what they're thinking. They're not thinking about, or they're not talking about necessarily the part that goes above the gum line. They're talking about the part or the replacement root that goes below the gum line. So the next part is, well, how do we make an implant functional? How do we make it to work like a normal tooth? So the next step is, after the implant is put in, an attachment can be screwed in to the implant, which is called an abutment, or it's like a post, basically. So it's something that goes above the gum line. And so now we have a post that's connected to the implant. And then what we do is we make a crown that seats on the tooth like this, and this is how you get your tooth back, basically, is by putting the crown on. So that's how a dental implant works. You have the three parts. You have the implant itself. You have the abutment that screws into the implant, and then the crown typically is cemented onto the implant abutment, or sometimes they can be screwed on. Okay, but either way, the main point of the dental implant and why it's the most superior and by far the best way to replace a missing tooth is that it's actually anchored into the bone. So unlike other ways of replacing teeth in the past, this is the most natural and most it's the closest thing, let's put it that way, it's the closest thing to having a natural tooth. So in the past, what have been some other ways of replacing teeth? Well, one way was to have, let's say we're missing a tooth here, okay, and we didn't want to do a dental implant, but we did want a tooth in there that didn't move around. So what used to be done in the bad old days, back when I was in dental school, years ago, before electricity, actually it was back in the 80s. But anyway, so what would we do in a case where we had a missing tooth? Well, what we were taught years ago, and what was accepted for the last 150 years, is to do basically what's called a bridge, okay? And when we would do a bridge, what we would do is, on either side of the place where the tooth is missing, we would reduce these teeth and put crowns on them. So some of you may be wondering what is meant by that. So a crown is basically a covering that goes over a tooth. So this is an example here. This tooth is basically kind of made into a stump, and then the crown goes on top of the tooth. Okay. Now, if you wanted to replace a tooth that doesn't move and yet not use a dental implant, you can reduce the teeth that are on either side of the gap, like you see here. So these are now kind of stumps, but they're still healthy and they're still okay. And what you do is you make a crown for this tooth and this tooth. But instead of making single unit crowns like this, what's done instead is, when these teeth are reduced, you make a false tooth that's fused to the other crown. So this is a good example here of what a bridge is. And it's called a bridge because the false tooth is bridging the gap between the two support teeth. So again, the teeth on either side are reduced and crowns are made, but instead of making just two crowns, we put a false tooth in between that's fused to those crowns and connects them, and then that goes on as one piece. Okay, so that's called a dental bridge or a fixed bridge. We like to say fixed in dentistry or medicine because it means it's secured. So anyway, this is secured. It doesn't move, it doesn't come out, and it's cemented to place. But what's the problem with a fixed bridge? Well, the most obvious problem is what I call a three-tooth solution to a one-tooth problem. So we have these three teeth that are involved with the replacement of one. We're having to use and reduce these two teeth in order to just get back one tooth. So that is a problem, or it could be a problem, because we have to reduce and cut down other teeth. That's probably the biggest issue with the bridge. The other thing is that if you have a problem later on, let's say if there was a little bit of decay that had formed years later around one of the support teeth, you can't just take that part off and replace it. You have to actually take the whole bridge off and replace it. So that's another problem. The obvious advantage, about a dental implant is, number one, it is a one-tooth solution to a one-tooth problem. So if you are missing a tooth, you can use a dental implant to replace that tooth. You don't have to touch these other teeth. You don't have to worry about them. And another thing, as far as decay goes, if you look at this, there's no part of this that's a natural tooth structure. This is all titanium and metal, okay, or porcelain. So the one nice thing about a dental implant is that it can't decay. So that's basically how a dental implant works. Now, and that's how it works to replace one tooth. Now, of course, you can expand on this, and you can have a dental implant replace one tooth, or two teeth, or three, or a whole set of teeth. So basically, I wanted to show another example of dental implants being used to replace a set of several teeth. So in this case, it's lots smaller here, but what you can see is that this is a dental implant and this is a dental implant. And what we've done is there's a false tooth in between. So if we were missing a segment of teeth here, we don't have to put 3 implants in to replace 3 teeth. Okay, actually, we can bridge the gap like we did with the fixed bridge, okay, fixed to natural teeth. We can do the same thing with a dental implant. So we take that bridge off. You can see here's the implant with the abutment or post on the coming out of the gum, and here's the implant with the post coming out of the gum. So if we were missing 3 teeth here, again, we wouldn't have to do 3 implants. A lot of people think you got to do 1 implant per tooth, and that's not true. You can put an implant in one side and an implant up here, and then make a false tooth just like a fixed bridge. And this is actually a fixed bridge, but it's supported by implants instead of natural teeth. So it fits on like that. So, the next question may be, okay, well, I'm missing all my teeth. What do we do there? And so there's several different options for tooth replacement, for teeth replacement when it comes to a person that is missing all their teeth. So the conventional way, obviously, of getting people back their teeth is, if they're missing all their teeth, is a denture, okay? So what are the problems with a denture? Well, anybody that wears dentures will tell you that one of the problems is there's going to be some mobility or looseness to the denture. The denture is going to move a little bit. Now, getting back to our model here, one thing about what God gave us, and not just us, but all animals, is that the teeth are not supposed to move. Okay? When you bite into an apple, the teeth aren't supposed to move around. But when you get into a denture, especially a lower denture, since there's nothing, since it's not really anchored to anything like natural teeth, and a denture is not anchored into the bone like natural teeth, there's going to be some movement. Now, there's a great deal of variability as to when a person gets a denture, how well they can tolerate that movement. And there's a great variability in how much movement can occur with a denture. So let's just talk about the top denture for a minute. The top denture, if it fits well, it's still going to move slightly when a person bites down. And the reason is because the denture is sitting on top of the gum line. Okay, it's sitting on top of the bone. It's not anchored or rooted into the bone like a dental implant. And so even if it grabs the gum well, when you bite down, the tissue will depress against the bone. Sort of like if you're walking on a carpet, okay? A nice soft carpet, your foot is going to depress the carpet ever so slightly, okay? Until it maxes out on the hard floor. So anyway, a denture is very similar to that. The gum tissue is sort of like a carpet or a cushion, and when you bite down, it is going to move a little bit. So that's one issue. Now, how much movement occurs and how much a person can tolerate that, you could write a book on, because there's a wide degree of variability among people as to what they can tolerate. But I can tell you this for sure, that no matter if a person can tolerate a little bit of movement or not, the movement is going to cause a loss of chewing ability and chewing power, especially the force that can be exerted. So when people go from teeth to dentures, upper and lower denture, they will lose typically in the first several months about 80% of their, or in some cases even 90% of their ability to chew, because they can't generate the force because the denture moves. And again, God didn't make us to have teeth that move around. So the problem is that they lose a tremendous amount of force that they can generate with their teeth. And what does that mean? Well, now all of a sudden, instead of being able to bite through a steak or even bite through an apple, they can't eat foods like that. And that becomes a problem because they have to then rely more on soft foods. And as we know, most processed food is soft, and processed food is really not something that's so good for us. And so anyway, it forces people, however, that have dentures to have to seek out a softer diet, which unfortunately a lot of the foods associated with soft diet are not nutritious for us. So anyway, number one is that the denture is not fixed in place and tends to move. So what about if we, so where could implants help a person? And there's a couple of different options for people that have dentures that they're just not happy with them. They can't bite, they can't chew, they can't enjoy their food. And they really, it really makes a big difference in their lifestyle and how they see themselves. Some people even become very reclusive because they can't chew, they can't enjoy their food. They're afraid if they smile that their denture may even fall out. So what can be done for these people? Well, fortunately, there's, like I said, a couple of different options. The first option is where implants are put in the jaw, usually 5 or 6 in the upper jaw or the lower jaw. 5 or 6 implants are put in, and then it's basically like a bridge, but it goes all the way around the mouth and includes all the teeth, is secured and fastened to the denture, or excuse me, fastened to the bridge. So this is an example here of a situation where this is actually called a bridge, although it looks like a denture. And you can see in the clear up here that this represents the bone. This is where the implants are. And the teeth, or the bridge, is actually fixed or secured onto the implants. Now, you may be wondering how that is. And if you look here in this view, you'll see that there's little, might be hard to see here, but there's little openings. There's, in this case, there's 4 little openings, okay? And inside the opening is a little screw that attaches the bridge to the implant. So basically, this is secured by the implants. The only way to take this out is to have a little screwdriver to get in here and remove the screws, and then it'll come off of the implants. Another big advantage, and this is for the upper jaw of the dental implant, is that for the upper jaw, in a denture, the denture covers the whole palate and the roof of the mouth. And I have had patients come to me and say, you know, doc, I just can't get used to that acrylic. I cannot get used to that denture to replace my upper teeth, because I just can't stand the feel of that acrylic covering the roof of my mouth. And this is actually not an unusual problem. There are people that just can't tolerate that. Now, of course, that's another thing to keep in mind, is when you wear an upper denture, it is going to change also not just the fact that the teeth may be a little loose, but it's going to change the sensation of eating, because when you have your natural teeth, you can feel the food go up into the roof of your mouth. There's actually salivary glands up there in the roof of the mouth also, along with the tongue and underneath the tongue, that secrete saliva, very small amounts, and that's part of the chewing process. Is we bite into something, it basically goes into the roof of the mouth and it bounces off that, and then we chew it up and it goes to the roof of the mouth again, and back and forth like that until we can swallow it. And if you think about how you eat, that's exactly what happens. So now all of a sudden, if we take the teeth out and put a denture in, guess what? It's gonna go up against that acrylic, and some people just can't get used to that. So I do get people that come in and say, you know, the denture, I just can't get used to the acrylic in the roof of my mouth. So this is always what we talk about, is something that's secured. And because it's secured with implants, we can remove the critical part here, which is the roof of the mouth, so that the patient can have the sensation, again, of feeling food going up against the roof of the mouth before they chew it up. So that's one way of securing teeth. Now, you can also do that for the lower, and I have another model here. This shows the lower fixed implant bridge, or hybrid bridge, okay? And it is secured to these implants, okay? And you can see again that it's secured because there's little screws that go in through the teeth, or the prosthesis, that attach and fasten the set of teeth onto the implants, okay? And so again, this is another way of getting back the closest thing you can have to natural teeth, is putting implants in and then securing or screwing down the fixed bridge onto the implants, okay? And it doesn't move. I kid people, say, well, we can hang you from a crane with those teeth because it's not going to come out. So that's another way of doing it. Now, there are some other options too. And by the way, as far as upper versus lower, I would say that in general, people have more problems with the lower denture moving around. And so in general, we'll see more of a demand for implants in the lower jaw than the upper. So what are some other options that can be used? Another option is basically just to put 2 or 3 implants in. I tend to favor 3, and because it creates more stability. But we have a model here that's showing 2. Either way, what can be done is implants can be put in like you see here, and then on the top you have this little post with a ball attachment, and then on the inside you have a denture, but you put the female receiving part in the denture, and it basically snaps onto the implants and it holds the denture in place. So that is one example. Here's another example with a different kind of attachment on it called a locator. Again, the implant goes in, but the part that goes above the gum line has an attachment and we'll call it the male attachment. The female attachment is put into the denture and it snaps in like that. Now, the difference between this and the other is that this is still supported by gum tissue here. So what this does is it's holding the denture, and this is a denture really because it's supported by soft tissue. It's holding the denture in place, but you can see there's still going to be a little bit more movement to it. And again, because most of the support is on soft tissue, when a person bites down, that's still going to depress a little bit, okay? And of course, it's a little bit easier because of still having a little bit of movement to get food and things like that underneath it. However, it is a dramatic difference from having no implant at all. So that's it for now. Thanks for listening, and we'll talk to you next time. Bye-bye. This is Dr. Chris Hughes, and we'll talk to you later. Bye-bye.